These guys have boyfriends and girlfriends. They want to get on with life in those regards. But how would you satisfy your girlfriend and boyfriend with no money? I thank you.
Ladies and gentlemen, this is Uma TV. We're here at Mulago Guest House, press release of interns. They have special message and complaints towards the government about the salary scheme. Ladies and gentlemen, tune in on Uma TV. Naiko Todan presents for more details.
Not come out to clearly state what they have for us. Now let me give a scenario. Remember, we are at the front line. Generally, before even a specialist gets to know this patient, we clerk them, we receive them, we give emergency care. Now imagine if this patient is having Ebola and I get to acquire the disease and God forbid I happen to die. You mean you expect my parent not to be compensated because I'm being considered as a student? What you're forgetting is that when you were a student, you are not at the front line of services. At some point, you're going to just listen to your consultant or to your doctor that is going to guide you. And in some instances, you're not even allowed to touch these patients. But now, when you are an intern, you get to touch patients. And when you get to touch patients, now imagine if you contract a disease, let's say tuberculosis, let's say Ebola. You mean you're not going to be compensated for that small time? When you get sick, who is going to treat you? You need this money. If you get sick, even if money is available, or medicine, if medicine is available in the government setting, at that moment you're unable to perform your duties. So you need some money to cater for your well-being when you are sick. So that is why we are saying that this policy is totally draconian, and it's not good for the well-being of Uganda.
Yeah, you're right. This is Edgar Eleviona. And to talk more about what you're trying to suggest, the other time we talked about the socio-economic realities and financial survival as part of what? As part of the government's provision. And we said that healthcare delivery will require physical presence, high concentration and resilience. Expecting interns to work 36 to 48 hours shift without financial facilitation for housing, meals, transport and basic utilities in high-cost hospital environments is both unsuitable and unsafe for both the health worker and the patient. So recently, we lose a doctor over addiction issues, right? And the issue was that these issues, not that the person comes up or grows up when they are drug addicts, right? But within this environment that requires high concentration and resilience, you find someone to push much more. They start these drugs, right? So in so doing, you find that this person now is getting addicted and they cannot leave this drug in a peaceful way. You get it? So they end up getting issues and getting messed up by the drugs. For example, the other person, we lost here in Mulago another sickler whom they thought it was probably stress alone, but this guy was also using what? Drugs to make him push much more further as a person who has to run a ward of over 100 patients per day with other colleagues, despite. So I was saying that surely the government, mostly the honorable ministers, directors and esteemed stakeholders should also see in this matter and see that the matter of assisting an intern leave or sustain the work of the government surely shouldn't be on personal grounds. I submit. The government still doesn't what? to still think about that, because we said that one, a burnt out, starving and financially destitute health worker in a high volume emergency room is totally a liability to our patient. Get it? So it means that literally you're not going to help the patient, because that was 2 weeks back where we got one in Kawempe who collapsed on the theater table after just a few minutes after starting the operation. And surely, so if this person is there out and is being taken as any other health worker and is being employed by the government, this person would have at least fed and come up as any other doctor, very strong to push for that day. You get it? But now I just imagine out where this person, for example, is trying to do a surgery, where some surgeries people consider them as minor surgeries, where to me there is no surgery which is minor for a doctor, and probably they are alone and they black out with a patient, and you find that the patient is probably even resuscitating the doctor. Now I would ask myself, who is the patient and who is the doctor? And so to me, ideally, a lot is being demanded. So recently, I think it is that is not last night, we had that the internship list has come. Alongside, rumors also came, and they were like 750 is going to be paid for the non-government, and 1M is going to be paid to the government. So we're asking, ideally, some bit of clarification. Is there any patient in the government facility that is a private patient, and this one is a government patient? Surely we also want some clarification surely about that. Why are they trying to show a lot of what? A lot of corruption over this. Get it? So surely we need a lot of what? Clarification.
So I think the policy makers, the makers of this shambolic policy, they are plotting something. They are trying to turn interns into students, which is wrong. Intern doctors are never students, and they will never be, because these are students who have fulfilled the requirements for the award of their bachelor's of degree in medicine and surgery. So they are trying to dodge that and make them students in order to dodge the responsibility of paying them. So as we have our 1, 2, 3 as the interns of this current cohort: deploy all, pay 4M monthly. That is our 1, 2, 3. Thank you.
My name is Taiwa Ignatius. Me, on this shambolic policy that they recently passed, I think it was unfair, because first of all, they did not involve anyone. They didn't involve the UMA, Pharmaceutical Council, Nurses Council. They just sat there and passed their policy, and it was rejected. When they brought it to the public, it was rejected. And I'm wondering, it has always been a concern by some MPs. They have always been raising an issue that if that policy is genuine, why can't they bring it in Parliament and they discuss about it so that they can see the way forward? And the ministry has always been reluctant, promising that we are going to bring a comprehensive statement, not until when we had last night that they released a list of internship. And now we are asking ourselves, are we going to be slaves if we are giving a service? If they are willing to give us provisional license and we work, yes, they know that we are giving a service, then why can't they pay us? May I see this policy has many loopholes, and it needs to be revised and withdrawn until they engage different stakeholders so that we can reach on a consensus whereby interns have to be paid and not being slaves since they give service to the country. Thank you.
Let's go. So amanya gange nze Dr. Ainebyo na Edgar ndi musawo, so akulira abamu ku bagenda okugezesebwa kitwale twogerako waneeno tuli mu kwogera nti list z'abasawo abagenda okugezesebwa zafulumye jjo, naye nga tezinafuluma waliwo ensonga gye bali boogerako gye twali twogerako nti balina okubeera nga balina ensako ze babawa zino ensako nga zigenda ku at least miliyoni 2.5 ku 4 naye nga omukulembeze yali yagamba nti bawawe at least miliyoni 2.5 eziri ekitundu ku omuntu already ali mu services zalina okufuna naye bano abantu abakulira abasawo mu gavumenti oba mu parliament bo nga bo babadde baleeta bagamba mbu ensako egiweewo so ffe nga abasawo tuvaayo tugamba nti omusawo yenna tasobola kukola nga talina nsako eno. Ekyokubiri omusawo yenna alina okubeera nga ali muyonjo. Ono omusawo alina okubeera nga akola essaawa almost 3:48. Ono omusawo alina okubeera nga alina waasula. Ono omusawo alina okubeera nga alina ebyokulya nezinamuyambako ku ntambula n'okubeera nga alinako ezinamuyamba. Waliwo osanga nga awantu awamwetoolodde nga wa sente nyingi n'emmere gy'anaagula oba ebinaamubeezaawo. So ne tugamba kino ekintu kijja kubeera nga kya muwendo nnyo ku musawo ono atalina kasente. So ne tugamba mbu ekyokubiri omulwadde alina okubeera nga addibwamu amaanyi naye ono omusawo waba tasasulibwa anaabaawo atya. Ekyokusatu twali twayogera ku ekitiibwa ky'abasawo. Ekitiibwa ky'abasawo edda twawuliranga omusawo yenna wamala ekitiibwa kikola kidda kuba abamuweerera ne gavumenti nayo ewuliramu ki. Naye kati abasawo wetugamba mbu abagenda okutandika okukola kati zino essaawa bakola ku bitundu 6 ku buli 100 ky'abaana already abali mu service. Naye kati ono omusawo we bamuleka mu ddwaliro oba mu wards azimanaging nga talina nsako wadde kinaamubeezaawo kiba kitegeeza tagenda akola ki kumalako. So tubadde tuyita ebitongole ebirinaanye ebya gavumenti ne gavumenti yennyini eje eyambeko okukola ki okulaba nti bano abasawo abagenda okukola ki okutandika okukola mu guno ogw'omunaana bakole ki babeere nga bayambibwako babeere nga bawabibwa ensako. Tuyanziza
anyo nyenda kuteera tooki mu rugendo rwa medical students ninga omushawo kuza kutendekwa n'abarabire enkayi. Amazina nabanyeta Nomani oyesije ndi omushawo ori mu kutendekwa konka nanyesha yona niza kuza omu intern nk'abandi. So egipolisi twena netu affecting konka nanye nambaze ntangaze abaturikize bona ninga bakutureba intern nabarabire enkayi kuza kuba intern nga kuza kuba omushawo noborabire enkayi nobanza nichitandika senior 4 okora okay it starts from nichitandika mu P7 ori kuza mu secondary oshoma sciences okoma senior 4 ocheza senior 4 oshoma science courses like BCM PCB there ono bano mauna aza kuza mu science world. So kokeza senior 6 uwa applying kuza university. So medicine ne myaka 5, dental surgery na ne myaka 5. So twine nabanda bakushoma pharmacy, twine nurses. So bona bari mu field yobuki obushawo obari abari yombe mu departments zitakushana onkabona bakoro mu madwariro. So orukuza kuba mushawo nabatendekye kumara emyaka 5. Then kwa bwanyuma y'emyaka 5 nabayine kora internship page neyo mwaka gumu konka kuza kufika mu internship no banzo jwara ekijwara ngashe kitweta degree ekikumanyisa ngu byona eba kushomise okabika wamara hatuya ori omushawo. So government nije bateeka omu myanya ninga shi tweta placement sites kugira ngu muze mwembaze kubashunshura ninko kushunshurwa ninga transition kugira ngu otakagire kutandika kukora wenka obanza oraba omu mikono y'abakugu kugira ngu ebyo orabe wayegire omu medical school otakakwasire gye obikwate gye munonga hati konka oba already noba nojanjaba orikuha service ihanga so nicyo tukugirira ngu omushaho weena ori omu internship already naaba aine ekitiinisa ky'obwa doctor so ashemereire kuba nashashurwa ahabwa service yakuba naheereza ihanga konka government eresire policy erikugira ngu hatiya internship omwaka gwa internship bagonje yari 5 ebe mukaga mbwenu oguma ori omwegi otaba omushaho oguma ori omwegi riyare eki kintu oguma ori omwegi meaning wo ori omwegi tabakuza kushashura already hariya kuba ori doctor ngo kuchitwire nabine kushashura because ori doctor ori qualified oshobora kuba noshashurwa
kati bumukulaba occupation teina buzibu n'abakola occupation tebalina buzibu wosuubira ani omutuufu alina okufikisinga eyo ensonga
Ministry of Health na Ministry of Education and Sports bakakwatagana bona bayita age policy so ni ministries ibiri so officials abari muri yezo ministry gashime kushita mansi baka revising age policy ninga baka buza abandi abebitongorebya ebikurura abashaho ninga shazi tweta associations ninga other stakeholders babengaging batisa policy because age policy it is dead on arrival.
Okay, say goodbye to us.
So when our chize itwenka ba interns ninga medical students bono omuyanga age policy ndujanga kandi tujanjara kimwe bashashura bashaho bitundu 75 ebichweka 75 ari government ari kushashura bashaho benyi n'abaruka abarabiro mu internship abari ya government baguma bashashure buri kwezi biyo na discrimination.
Take up emotions.
So, what are your complaints? So, the Ministry of Health and the government of Uganda think that patients' lives will be safe when they are served by hungry doctors, nurses, and midwives. All we are trying to say is that doctors, nurses, and midwives who are doing their internship deserve fair compensation for their time and effort, but also for the safety of the patients themselves. How do you expect a doctor who is worried about accommodation, food, transport, and their welfare to take care of their patients effectively?
What do you suggest the government should do?
The government should, with immediate effect, withdraw that shambolic policy. At the very least, revise it, because there are some of the lines and statements in that policy that make us wonder that do people who sit in these rooms and make these policies consider the situation on ground. So we say no to that policy, and if the government of Uganda does not revise it, we are not showing up for that internship. Absolutely. We are not showing up.
You as a student leader, did the government first consult you before?
No, the government didn't consult anyone. If our own training institutions, our deans and all universities in the country that train medical professionals were not consulted, would you expect the government then to come and consult students? They didn't do that. Would we be here?
Among one of your demands is the facilitation you want from government. How much are you asking the government to give you?
In 2021, the government of Uganda, through the President Yoweri Kaguta Museveni, after pulling ropes here and then, they agreed to pay interns 50% of the fee that
an enrolled medical officer earns. However, that was after bargaining from what is documented, the 75%, which translates to about 4 million Uganda shillings. So since the government doesn't want to pay us, we are now telling them we have been fair by accepting 1 million. Now we want 4 million Uganda shillings for our time.
Okay, thank you very much for your time.
All right.
Yes.
The expression is good, and you, the operators, are perfectly needed in the nation. So who is pivotal for that flow that is affecting you as interns?
I think the government of Uganda, through the different ministries, the Ministry of Health and Ministry of Education, they are both trying to run away from their responsibilities. The Ministry of Health employs doctors, but then they are trying to say that these doctors are not not doctors, that they are medical students, and they are trying to push doctors, nurses, and pharmacists back to the Ministry of Education. That is unacceptable. You simply have to allocate money and pay the doctors, nurses, and pharmacists.
Can you translate your complaint in your local language so that even the commoners can understand you?
Sasa akirona bala shongonye sino ebe eja shongone doctor anasin katoni pharmacist wadata kisha ekota pugan ko ikasa somalong ne yaute iborne ronono kame kamana rakatoni eja utene kaluka de kaklebuneta dekis e doctor la retenge e doctor lema meteka na mkapero e doctor lema meteka to net transport alo stadekis mamke beki na jaini kinyo bali twaniko kopkanen so nyise nak shongo la ngedro shongo akirone kotapugana yao nebe mamke se kosa kitach anasin doctor katoni pharmacist le jani kineto sika dexin koskere
Conclude with the name.
Enge what like Dr. Okorobe Pasco Matthew, intern doctor.
Thank you.
There is this one. That one the passport. This one.
Ladies and gentlemen, eno Uma TV naikotodan presents Emmanuel Moses Senyonga. Tuli wano n'omushiija aina complaints zaina intern as well as the parliament ne government ya Uganda. Are you gonna use English or the local language?
Local language.
Okay. Present.
Itwe nka intern zabo kuzakuza mu internship ogomwaka twine demand zitu ezimukoreba hano ya manira echo kubanza ba withdrawing a policy echa kabiri bona abashome kwana bazo mu intern babatekeyo then echa kashatu babashashure buri kwezi kandi babashashure miliyoni 4
Deploy all.
yeah.
Pay
So
all.
deploy all, pay all, pay 4 million, pay monthly.
Pay monthly.
Thank you.
Welcome.
Twagala sente. So
Ogenda kweyongera ko emabega katini. Kati weyongere ko eri side. Yes. Tuli wano n'omusawo ewenjawulo agenda kweyanjula amanya ge. Sebo ogenda kozesa luzungu Luganda.
byombi mbisobola.
Sebo ekikulese wano ng'olina kuba ng'ojjanjaba abantu kiki?
Ekindeese wano kugamba gavumenti nti omusawo omuyala tasobola kulaba balwadde. We are saying a hungry doctor is an angry doctor. And the last thing you want to see when you come to hospital is an angry doctor. They won't attend you, they won't attend to you to their capacity. So please, we are requesting the government to reinstate the presidential directive. And that should actually be 75% of what an MO earns for the medical interns. That means for us, we should be getting 4M to cater for our needs as interns. We are not slaves. We are humans like you. Please consider our needs. Thank you.
Okay.
You can talk about the different
Wait, you say what do I need?
For me, I'm for it, and I think one by one is going to be okay.
You want the big ones to confirm that the sound is recording.
No, normally it's very easier when there's a public system.
Yeah.
But currently, I don't know how I'm going to do it.
Who is in charge of this organization?
I don't know, I was just invited. So I don't know who's going to talk, I don't know who's like.
Deserve fair compensation. Guys, you want to see your faces? See your faces?
We're going to put it clearly, actually for front line. We're going to put it clearly, actually for front line.
I'm going to extend.
Yeah.
I don't want it up now.
Tukoye jogo. Chimera. Yeah, appreciate. Tetukala baka 75. Want. Nice. Right family. Your labor.
We appreciate the deployment.
Finished. Finished.
They must pay you commensurately and they must pay you on time. Who in this world? By my age, I have many streams of income. Right now, here I was on a phone call. Someone just made it. He wants me to sell my milk trees. He has a cooler. I have trees, I have cows, I have stones. Hey, by my age, I have many streams of income. Okay, some of you have are not very young, like this one. But you don't expect to have any other streams of income. This is your first job. He's young. This is your first job. This is your first livelihood. I don't expect to have any other stream of income other than what government is giving you. So if government doesn't give you money, where do you get it from?
I'll be first. A good afternoon to everyone. Dear citizens, colleagues and members of the press, we the interns of 2026-2027 cohort have come again to express our discontent regarding the impish neglect of our concerns by the Ministry of Health and the Ministry of Education and Sports. 1 week ago, we raised our concerns through the media and in writing to these stakeholders, which were, number one, immediate withdrawal and consultative review of the NET policy. Number two, enforcement of the 2021 Presidential Directive and adjustment for inflation. Number three, transition to prompt monthly payments. Number four, full and timely deployment of all pre-interns. We made these requests with meek diplomacy, but the stakeholders deliberately ignored us. Therefore, we have chosen to escalate. Last night, the internship deployment lists were out before responding to our demands. How do you expect someone to go deep in the remotest areas in the country without any facilitation for their basic human needs, like food, accommodation, etc.? A responsible government takes care of its own civil servants with the same passionate, altruistic spirit in which they serve. We have dedicated our lives to serving the nation. Is it too much to ask the nation to facilitate us with the bare minimum? We are not asking for wealth or riches. We are asking to survive. Therefore, after we are done with this press conference, we are going to march to the ministry to personally hand deliver our message in writing that we sent them last week and they ignored. I have not many more words than that. Thank you. Yes, my name is Dr. Sigonga Silva. I'm the head of pre-interns and right now the acting head of interns 2026-2027 cohort. Yes. Segonga.
Yes. Pharmacist representing the intern pharmacists. Now, about the new policy, it is so uncouth and shambolic because we as pharmacists in hospitals, we dispense these drugs. We are responsible for patient care. We manage inventory of drugs. So one, if the government does not facilitate welfare of interns, it means the drugs are not safe. Because if our livelihood is at stake, we are most likely to take these drugs, sell them, such that we can live, because we can't live without facilitation. So to avoid pilferage of drugs, government should facilitate the interns. Now even patient care is at stake because pharmacists cannot take care of the patients when government has put these intern doctors in a state that they are worse than patients. So the drugs will not be managed well. Patients' safety is at stake, and the medical system will be crippled by this policy that has been put by government. Everybody has criticized this policy, but government has refused to respond. We call upon government to respond with immediate effect, to come up with official documents to facilitate the interns. Let them give us our allowances, and we demand for 75% of what a medical officer gets, and that is 4 million. Thank you so much.
Hello, good afternoon, countrymen and women. My name is Tumaze Brian, an intern nurse, and I'm here on behalf of the intern nurses and midwives in the country, the 2026-2027 cohort. As intern nurses and midwives, we also stand against the current policy that was introduced by the Ministry of Health, and we strongly reject it without hesitation. Intern nurses and midwives, we also stand with the fellow associations that have stood up to reject this policy, and we come up with these are our requests we make. First of all, we request the cabinet give us a report as they promised to review the policy. We need it with immediate effect before we report for our internship. Second, we also require assurance for the adequate payments for all the intern nurses, midwives, and other interns. For the interns make up over 75% of the health care in Uganda. Thirdly, we also request for equality among all interns. We stand against the segregation against the government interns and the private interns. For we are all equal in the service delivery. We reject that segregation. Lastly, we request for the immediate facilitation of the interns that have been deployed to ease their reporting to the different sites they have been allocated to. For we have been students, we don't expect to have anything at hand to request to allow us settle in different sites. Otherwise, thank you all for God and my country.
Ladies and gentlemen, to the fellow countrymen and women out there, we come to you once again as the medical interns of 2026-2027. Ladies and gentlemen, as you are all aware, that ever since the health policy was launched on 29th of April 2026, we have made several attempts to seek dialogue with the concerned parties, but all have been unsuccessful. the Ministry of Health and other government stakeholders have completely ignored our cries, despite the fact that they have publicly proclaimed that they will be able to revise this policy. We feel we've been ignored enough, and we have been treated unfairly by those we hope to run to for answers. The government of Uganda, specifically the Ministry of Health and Ministry of Education, have not committed to seize or even halt this policy, despite their earlier promise. A policy that seeks to psychologically and emotionally, physically exploit the medical interns. A policy that intends to cause gross financial distress to the medical interns. A policy that puts the lives of the intern health workers and the patients in the harm's way. Therefore, ladies and gentlemen, having exhausted all these avenues, and we have been met with resistance and silence, we are only left with only one civil apparatus, and that's not to report to our respective sites until we have reached a consensus with the concerned authorities. We therefore call upon the authorities, the hospital directors across the countries, to bear with us as we harmonize and try to put things right and save the medical fraternity. Thank you so much.
Dr. Florence Namutevi, and I am here representing the Federation of Uganda Medical Interns who are finishing their internship. We have 1 day to the finish of the internship, and I am here so that we can stand with the coming cohort of the interns in regards to their deployment. It's quite unfortunate that when we were here last time, we addressed or aired out some issues or concerns to the stakeholders in regards to the placement of the medical interns, and up to now, we have not got a positive response, or actually any response from the responsible people. I would like to bring to the attention of the Ugandans what a medical intern, what a tragedy it is to deploy a medical intern without facilitation. As a person who has been an intern myself, and now remaining with 1 day, yesterday we saw that the ministry released a list of the interns, and they are supposed to report to their areas of deployment by 3rd of August 2026. And my question would be, how are they going to reach there? How are they going to maintain their lives while they are on those sites? Because some people actually say that it's hard for someone who has been deployed in a far site to maintain themselves in day-to-day living. But even if a person is in Kampala, let's say you stay in Nansana and they have put you in Zambia, you still need transport to Zambia. You still need transport from Zambia to Nansana. Because as we very well know, that internship sites have accommodation for some interns, but not everybody. So there are some interns who are going to be even in those sites that claim to have accommodation, and they will not provide it. We know that many internship sites across the country are not providing food or anything to eat to the interns throughout the day or throughout the night. So our question is, how does the ministry expect the young doctors, the young nurses, the young pharmacists, dental surgeons to reach those areas that they have put them, and how does the government expect that these people live up to the standard of a normal Ugandan? Because you can see that patients who come to the hospital, they have something they are eating, they have transport that brought them, but take a scenario of a doctor or a nurse who is working on you, a Ugandan, and you know very well that they are not going to eat, they have not eaten, and they have no hopes of having a meal that day or the next day. So we are here again, that we call upon the government, the stakeholders, the Ministry of Health, Ministry of Public Service, Ministry of Education, and also His Excellency, the President of the Republic of Uganda, that we get the amendment that was promised in regards to the policy, because the Minister of Health on several occasions has promised that there will be some adjustments that will be made, but until now we have not seen anything, and we cannot sit back. These interns have only 1 day for their official deployment list to be effective. So if they are to reach the internship sites by Monday, we need a response at least in 1 day. I do not know how possible this is, because we have been requesting, we came here last time when we had 9 days to the deployment to start, and now that we have only 1 day, this should be a state of urgency. I call upon all the Ugandans to stand with us, because the people who you're going to meet in these health centers, in these hospitals, in all places that are going to be seeking medical attention, I assure you there will be interns, and most of the times you will see that you will not get the service that you deserve if they are not facilitated. Thank you.
Greet you in the name of Apollos, the great physician, and in the name of our Lord Jesus Christ. First of all, I want to congratulate my colleagues, the interns, for having survived the first attack of this shambolic draconian policy, which was seeking to put them back into the universities and call them students. So I congratulate you, because you have finished, you have crossed that bridge, your universities released you, and you graduated. That was the first proof that this policy was shambolically prepared and therefore dead on arrival. Us as doctors, we don't fear talking about death. So the first part of that policy has been proven to be dead. It cannot work. I would like to congratulate a little bit prematurely the outgoing interns. They have only 1 day for having survived that 12 months. 300 of them have been moving without facilitation, because in October, again, Minister of Health released the document that they are going to withdraw their allowances. And they did. They are not joking. They did. So I want to congratulate them for having survived the 12 months, some of them without pay, some of them with some bit of pay, but for having come to the end. However, I would like to ask a small question. Why is the Ministry of Health and the powers that be keep behaving this way? Why? What crime did we commit? They asked us to do sciences. We did sciences. And we became doctors. Is that a crime? And why is it that our fellow doctors are the ones treating us the same way? First of all, you failed to consult your colleagues. Some of us may not have the appointments you have, but we are your colleagues. We sat in the same class, ate the same portion. Some of us were actually ahead of some of you. Some of you are our students. We taught you. Why don't you like consulting us? Why don't you like consulting Uganda Medical Association? Why don't you like consulting Uganda Medical Dental Practitioners Council, a body which is legislated into existence? National Council of Higher Education. Why do you do shambolic work? Why are you embarrassing our president by coming out with very shambolic things? Why are you trying to behave militant when you're not even able to perfect militarism? Why are you keeping these young men and women in the dark about the things you intend to do? And why are you meting out punishment? Some of these guys are your children. What is the problem? We don't understand. Can you learn to consult? I have talked with the elders in the Uganda Medical Association. You did not consult them. I've talked with the deans of the faculties of medicine. You did not consult them. I've talked with the vice chancellors of the different medical schools. Who did you consult? AI? But even AI consults many things. Or AI gave you the right things and then you edit it. Please learn to consult. Learn to synergize. We know you are bound by corporate responsibility. If ministry, if government decides something, you can't say. Learn to synergize. Because for us, we're not bound by any law. We are an association. Take advantage of us. We can look in the camera and tell the powers that be that you are giving little money to the Ministry of Health. They are supposed to get 15% of the national budget. You are giving them 6%. You are leaving a chinusu of 50 shillings or 500 shillings on the table, and you're expecting chicken. You're not even going to get water from the Mwala with your 500 shillings. Please, Ministry of Finance and the powers that be, put money in the Ministry of Health. You are underfunding and curtailing the work of the Ministry of Health. Honorable Balam and Honorable Namere are going around busting you, hospital after hospital, displaying you naked. Is it the responsibility of the doctors for patients who are sleeping on the floor? If the director of Mbara Hospital has got his staffing norms of 30% and is supposed to organize shifts, how many members of staff is he going to put on night duty and then on day duty? And then you sneak in at midnight, Honorable Balam, really? You sneak in at midnight at 3 a.m. and you're asking for where the in-charge is? You expect an in-charge of a health unit to be on duty at 3 a.m. Then what will happen in the morning? So, put your finger where the problem is. The Ministry of Health is grossly underfunded. That's why honorable people are dying without nasogastric tubes. A simple nasogastric tube. All hospitals. Let's go back to Mbara where you were, Honorable Barimos. You were there. What is the budget? 53 billion. That's what they require for their work. How much is given to them? 2.8. Can we give you 2.8 or 53 and then you fuel your V8? Honorable Balam, Honorable Namere, didn't you get out of your car, your four-wheel drive, and walked on foot? Is that the problem of the doctors or the local government? Underfunding. Fund the Ministry of Health appropriately. Then you can ask for results. Learn to synergize. Because first we can say these things, but you can't say them because you've been appointed. You want to please your appointing master. We understand your problem. Learn to synergize. Don't try military styles. We know how the military works. For you to unleash a military order, the one you're trying on these interns, keep them in the dark as if you're taking them to Chankwanzi, release lists at midnight. How can we release a list at midnight? And give them 2 days to report. That is military, my friend. What is the prerequisite for military action? They must be militants. They must be trained to obey orders. These are civilians. These are civilians. They don't know military things. So don't try military techniques on civilians. You will end up looking very bad. Yes, we'll get there. We know last year you tried to deploy all. I think you deployed all. Even this time your attempt was deploy all. If the list was not comprehensive, I know you're going to deploy all. Can we put an end to this pre-internship that you have created? 30 years ago, pre-internship was not a thing. You just waited at home to be deployed. Can we restore sanity so that these young men and women are excited to do their internship? They are not left in limbo, wondering, am I going to get my rotation or not? That should be what they should be worried about. Am I going to do pediatrics? Am I going to do internal medicine? Am I going to do surgery? Am I going to do obs-gyn? That's what professionals should worry about, not what am I going to eat? Where am I going to stay? How will I get there? Who am I going to borrow from? I've already borrowed enough for my tuition. Now who am I going to borrow from? Why are you causing uncertainty? Then you tell us about patriotism. Are you creating patriots here? Aren't you shooting yourselves in the foot? Are you even okay? You are not serious. You are not serious at all. So thank you as in last time's deployment order. After they have reported on August 15th, please submit the list of those who have reported so that we can process allowances. It is not there in this one's deployment. Why? Why? Does that mean you're going to pay them? If he's going to borrow money to go to Kalanga or to go to Masaka, He's borrowing it against what? We expect you to pay all. And we expect you to pay 75% of what Atanemo is supposed to get. Not 2.5 million of 2021. That is history. Inflation. Even things have changed. We don't want 2.5 million. We want 4 million. And please, why are you paying interns quarterly? Who on earth works every day, 24/7, and then is paid after 3 months? Do you think oxygen converts into glucose? Oxygen, which is free, until COVID showed us that even oxygen can be not for free. But the oxygen and nitrogen we breathe, you think it converts into glucose and converts into soap and Colgate and airtime? Me, my interns, when I deploy them, I tell them to report to me and report about my patients I've left them in charge of. They must call me and brief me. They are calling me with whose airtime? Their father's airtime? Their sugar mommy's airtime? Their sugar daddy's airtime? Because they have no time. First of all, they are not registered to do any practice other than in their internship placement. They cannot go to a clinic. They cannot go anywhere. So they are stuck in the hospital. But they even have no time to go and wash people's clothes and sweep people's jars and dig to make an end, to make their ends meet. So how do you expect them to survive, even if you decide to pay them between August 1st and October? You see, you're contradicting yourselves. You are paying it after 3 months because it's called an allowance. Okay? That means they are getting something else. This is a top-up. But now when it comes to someone who has a salary and is getting this an allowance, you call it double pay. Why are you double-sided? You are very wrong. And we will tell you, some of us are old. I have 6 years to retire. We are old. Look at the I have served my country for 30 years. Even if you tell me now to retire, I will retire honorably. I will not fail to have space where to get buried. That one I already have. What else do I need? So please pay them monthly. Is that asking for too much? Even guys who are paid allowances are paid PRN. After your gig, you get your thing and you go out with it. 9 billion Uganda shillings for interns. It is released in July. You want to pay it in October. Why? Are you a money lender? You are making profit out of it? Why? Because you are doing things in a shoddy way, you are inviting us to ask all these questions. Finally, Her Excellency, the Vice President, the Right Honorable Prime Minister, the Right Honorable Leader of Opposition, and the Minister of Health has said they are going to withdraw this policy and look at it. When? After these guys have starved? When? Why are you killing them softly? If that thing is going to be revised, declare, put it in black and white, that this shambolic draconian policy has been withdrawn and is going to be rediscussed. Put it in writing. We don't trust you politicians with what you say. You speak one thing with one mouth, and then the other side of the mouth speaks other things. Put it in writing. Then we know you're serious. Now we don't trust you at all. Because you can say one thing now on the floor of Parliament to get claps, to get off the camera, get off the spot, because you think they are weak. Were you not an intern before? You think they won't be ministers? And they're going to be ministers when you are 80. And you have your hemorrhoids. And your arthritis. They will remember you. And don't think everyone is an angel. And don't think others don't know how to revenge. You make them suffer. Once the red number plates have been stripped of you, once age has caught up with you, once the money you have amassed is no longer enough to take you abroad, you will be back, and back in our hands. And we will remember you. Very well. These guys are 2,407. Not so. 2,417. Maybe two of them might remember. And you may be unfortunate enough to land in those hands. Please, do not kick down the ladders after you've climbed up there. Leave those ladders for someone else to climb on them. I had internship allowance. We were getting 180,000. By the end of my internship, I was able to buy a car from my internship allowance. Of course, I borrowed from my colleagues. Yes, they increased, after Bayomosi's strike, they increased our allowance from 90,000 to 180. But there were arrears. Towards the end of our internship, we had, each one of us had $500,000. In 1998, 97, that was a lot of money. I convinced my colleagues, they mobilized it. I had my 4 million. I bought my first car from my internship allowance. Why don't you want them to even at least buy a cartouche or buy airtime? Maybe before you reach even food, or send something to their parents. Finally, who can we run to except to you, Your Excellency? Please open your door, invite us. We want to talk to you. Your ministers are killing us softly. The only thing they have not yet done is to order for our arrest and be put on Kabangali. That's the only thing they've not yet done. But the rest they have done. You are our only savior. Your Excellency, the President, we want to come to you. We don't know what information has been given to you, but please listen to us, hear it from our own mouths. And we also want to hear from your wisdom. We want to sit at your feet and learn. How did you manage when you had just finished university? In other aspects of lives. These guys have boyfriends and girlfriends. They want to get on with life in those regards. But how would you satisfy your girlfriend and boyfriend with no money? I thank you.
Era enkola eno eteeka obulamu bwaffe matigga si ffe ffekka naye n'ow'abantu ba bulijjo. N'olwekyo basebo ne bannyabo ng'abantu abagunjufu era abantu ab'eddembe nti tugezaako byonna naye tebatufuddeeko. Kakati naffe ne bisobera ne tukkaanya kimu ng'enkuyege nti tujja kukola kintu kimu ekyobuvunaanyizibwa naffe tugenda kuyimiriza okugenda mu ebyo ebitundu bye batutisa okukola okutuusa nga bakama baffe abo batuwadde akadde ne bakola kye balina okukola ne tukkaanya ku nsonga zino. Lwekyo tusaba Abannayuganda bonna babeere wamu naffe era babeere bagumiikiriza n'abakulembeze bonna abatwala amalwaliro gano mu ggwanga era gye tulina okubeera bakama baffe badirekita baani bamanye nti tugezaako kutereeza mbeera. Naye n'olwekyo bwe tutyo bwe tutuuse mwebale nnyo basebo ne bannyabo.
Mbalamusizaako basebo ne bannyabo. Amannya bitibwa Dr. Florence Namutebi era nga ndi mu kisinde ekikwataganya ba intani bonna mu ggwanga abanaatera okumala mu lunaku lumu olujja mu maaso nga mbadde nkwataganya ebyembeerawo. Olunaku lwa leero tuli wano okuyimirira ne bayintaani abayina okutandika okukola nga ffe tuvuddewo ng'ennaku z'omwezi 3 omwezi ogw'omunaana omwaka guno era ng'ezo nnaku nga 2 okuva kati. Tuli beeraliikirivu nnyo nti twaliko wano ne bannamawulire ne tuba nga tulina ebintu bye twateekayo okusaba kwaffe gavumenti ebitunulemu ne ministry ey'ebyobulamu na bonna abakwataganya okubeerawo n'okukola kw'abayintaani. Naye kyennyamiza nti luli twali tulina ennaku 9 ne tusaba tube nga tuddibwamu butya bayintaani abaana ababazzeewo nga ffe tuvuddewo bagenda kubeerawo batya, kubanga essaawa eno okusinziira ku kiwandiiko oba polisi eyaleetebwa eminisitule y'ebyokusoma eraga nti tulabe nga tutuusa okusaba kwaffe omulundi ogw'okulala eri bonna bekikwatako, tusobole okuba nga tutegeezebwa engeri ki gye basuubira bayintaani bano kubanga olunaku lw'eggulo lisiti yafulumye